introduce Benard Dreyer. Dr. Dreyer is the president of the American Academy of Pediatrics. He is a general and developmental behavioral pediatrician who has spent his professional lifetime serving poor children and families. Professor of pediatrics at NYU, he leads the division of developmental behavioral pediatrics, is director of pediatrics at Bellevue Hospital, and also works as a hospitalist. After graduation from NYU School of Medicine and chief residency at Jacobi Hospital, he stayed as director of emergency medicine, starting the first emergency medicine residency in New York State. For over 30 years, he led a primary care program at Bellevue, including co-located mental and oral health services and clinics in homeless shelters. His research is focused on interventions in primary care to improve early childhood outcomes, including early brain development and obesity. Welcome him with me, please. Is this hot?
Turn.
Did you turn it off?
I turn it off.
Where's the... Oh, yes.
Hello. Yes, since can you hear me?
Yeah.
Good, okay. Actually, I'm thrilled to be here today. It's the presentations that I've been asked to sort of comment on. Laura, Leslie, and I have been asked to sort of comment and make some summary statements about what we heard today. I'll throw a few of my own other thoughts, I guess I always feel I learn the most from families and parents and children, and so I guess I'm sitting here thinking the same way. Although the professional presentations were fabulous, hearing from parents and patients, I think, made the most powerful statement to all of us. So I'm president of the American Academy of Pediatrics. Who are we? We represent 64,000 primary care pediatricians, pediatric medical subspecialists, and surgical specialists from all over the country. And we're dedicated to the health, safety, and well-being of all infants, children, adolescents, and young adults. We very much focus on advocacy for children and families. Disclaimer, I'm here representing the AAP, but as you've heard, I've spent my professional life developing and studying interventions in pediatric primary care to improve parenting. So this is something I'm really passionate about, and therefore very excited to be here. So I'm going to sort of weave in some summary ideas and a few other things, but one of the things we heard today, and I'm just going to repeat it one more time, is the power of pediatric primary care. And I would say family medicine as well. I don't know if there are any family medicine folks in the audience, but I do not want to leave you out. There are 15 preventive care visits from birth to 5 years. 94% of children are now insured in the United States. In a state like New York, where I'm blessed to work, all children are insured. And nearly all receive immunizations prior to school. So there's high engagement in pediatric primary care, as you've heard. People trust their pediatricians. There's an ability to build on existing relationships and incorporate parent goals in a very natural way. You've also heard the medical home model provides support, although not necessarily funding. We'll get to that. And all of these interventions in primary care are really relatively low cost compared to interventions out of primary care for a variety of reasons. There's infrastructure, and there's a place, and there's a natural periodicity, especially in early childhood. So that's obviously one of the most important lessons. Pediatric primary care is a venue where we really can reach parents and children and make a real difference. And we shouldn't, and it's amazing how non-funded it is, in view of how inexpensive it is and how effective it is, you've heard today, and what a difference we can make. So that's number one. Again, you've heard this before, parenting is hard even without additional challenges such as poverty, abuse, trauma, and toxic stress, but of course, those additional challenges make it extremely hard. So these interventions are important for all families, but especially important for low-income families. And just to point out, almost half of children, 44% of children in the United States, are living in low-income families where the stresses of poverty and near poverty, even without ACEs, are extremely difficult for families. And we also know from science, just thinking about the evidence, that parent-child interactions are a critical mediating factor. This is just a bunch of studies that explain about 25 to 50% of the disparities occurring in children when they get to school. And these are social emotional disparities as well as language disparities and educational disparities. And these are due to differences, especially for low-income children in the early experiences in the home, and we can make a real difference in pediatric primary care. So we know that parenting is critical. We know that pediatric primary care is an amazingly important venue in which we can help families. I'm just going to not digress, but add a couple of extra programs that you haven't heard about to make a point, to make an additional point. So I always talk about Reach Out and Read. It is the most proven primary care prevention regarding parenting. It does change the way parents parent. It reaches 4 million children per year, and therefore it can act as a base for other primary care interventions. It's something where pediatricians are already involved in intervening in parenting, and is a way of getting to pediatricians to do even more. It needs sustained funding, just like all these other programs do. The other program we're going to mention is the Video Interaction Project. That's the program that we have developed at Bellevue and NYU. It's a relationship-based, individualized parent-child intervention from birth to 5 years. There are 30-minute sessions that are scheduled to coincide with regularly scheduled pediatric well visits. And just this February in Pediatrics, we published an article which showed that VIP had strong impacts on improving children's social emotional development, which is the topic we're talking here today about. Increased attention ability, decreased hyperactivity and aggression, and externalizing of behaviors. And so I don't want to focus so much on VIP, but the point I'm making is that in addition to programs specifically focusing on behavioral interventions based on promotion of reading aloud, parent-child interactions and play are actually effective in enhancing social emotional development. I think that's a very important point to be added. You heard about this from maybe 2 other people, so I'm going to be the third person to give a shout out to the new NICHQ Einhorn family report that's going to be coming out May 5th. And there's going to be a webinar, and if you go on the NICHQ website, I'm looking at Fan Tate, you can actually see when and where and how to connect to that webinar. So this is an advertisement to hear about that. What's interesting about that report is it actually focused on promoting young children's social emotional development in primary care, the exact topic that we're talking about today. And it makes some of the same points we make, which is all families benefit from enhanced social emotional functioning. It looked at many of the interventions we've heard about today, including Incredible Years, Healthy Steps, Reach Out and Read, VIP, home visiting, and actually Triple P was also included in that group. So it's actually a really good document to help guide us. And it talked a lot about how to scale up those programs, which is what we've been doing today. The other report I just want to mention is a meta-analysis The Promise of Positive Parenting Interventions. That's going to be actually published online today in Pediatrics, so it's hot off the press. There are copies out there that the AP staff have brought if you want a copy, but actually it's available online. And again, it looked at evaluating the efficacy of primary care-based interventions among children younger than 36 months. It reviewed 13 studies reporting parenting outcomes. I'm not going to get into all the weeds about this. And primary care-based interventions can't, the point is, good evidence that primary care-based interventions can affect positive parenting behaviors. Again, among the studies that were in this looked at are Reach and Read, VIP, and Healthy Steps, among other interventions that were found to be effective. And it pointed out, of course, even more studies needed to identify what other beneficial impacts these interventions can have, but I think the point that we're all making is we know enough, the science tells us enough that there are effective interventions. Fine to do more research. We can always do better, we can always make things better, but we know enough to move forward. So this is where I will add a few comments from what I've heard today that were not in the slides. That's why I have a little black slide there. And I would say a couple of things. Number one, prevention. We've all of the programs here have focused on prevention, but I just want to point out that what was very rich about this, and including one of the reasons I included Reach and Read and VIP, is that the prevention went from pure primary prevention, meaning everybody gets it, to at-risking prevention, meaning you offer it to people at risk, to people who are already identified with problems. And I think the message here is that there is a need for all those kinds of programs. Primary prevention reaches a very broad group of people and does a lot of good. At-risking prevention really then gives a somewhat more intensive evaluation and program to people who may not have problems yet but are likely to have them. And then thirdly, we need programs where we're beginning to see problems that we can actually help families and children who are already in that category. Secondly, early brain development. The most powerful time, we heard this before, I'm again just reiterating that, the most powerful time to help children is early. I always, when I talk about this, I usually show a newborn brain and a 2-year-old brain, and a newborn brain is about 1/3 the size of a 2-year-old brain, both in weight and size. So can you imagine what's happening in those 2 years? It's hard to make that up. And actually, I always point out that the 2-year-old brain is about close to the size of our brain, which actually explains why we often act like toddlers. So early brain development is a key theme. You've heard it. The earlier we can do this, the better. Doesn't mean you give up at 2 years. We've heard of the important work through school years, through adolescence, absolutely. But if we're going to start somewhere, we should start as early as possible. Rahil pointed out prenatally is really the key place to start. By the way, I should give another disclaimer. I know all the speakers who are here. Rahil and Diane and Ellen are good colleagues of mine, and we often talk about these things in other venues. It just happened somewhat completely by chance. Well, probably not by chance because we were all involved in this, but not planned by us to be here together. Finally, the need to scale these up. It's really good to show in small programs in one place or 5 places that these things work, but all families and all children across the country need it. This is not something we can wait any longer to do. And that's, if there should be study, it should be implementation study. How do you implement this broadly? How do you keep fidelity to the good work that we've heard about today when you start spreading it all over the place? Because that in and of itself is an issue. It's not only resources, it's fidelity to what you're doing. Because as you've heard, these are pretty controlled interventions by people who really are passionate and know what they're doing. And finally, these all are good investments. We could look at the cost effectiveness of every one of these programs and show you how cost effective they are, but most of the payoff is later on. It's more long term. It may be longer term, meaning a couple years later. It may be very long term, including adolescence and adulthood, but it's long term, and the payoff is not necessarily in the healthcare system. Some of it is, but a lot of it is in the educational system, in our economic system, in the prison system. So the question really is how to convince whoever's in the audience, who's staff in Congress, to understand that long-term payoff is key, the longer-term payoff is key. These are actually amazingly good investments for our country. I'm going to end by just these two next slides. One is, so which gets us to how do we value healthcare? And I think, again, Rahil mentioned this. We're transitioning to value-based healthcare, but this is based on high cost of adults with chronic disease. And so it's based on the concept of shared savings. Children's care is chronically underfunded to begin with, but interventions such as those we heard today are low cost and effective, but the value is the new standard, and parenting education meets that standard. And for children, value-based care must look beyond shared savings. We're not going to share too many savings now in healthcare. We have to look at shared savings much later, and rather we must look at improved outcomes and then those long-term savings. And I think that's a hard sell for us with CMS, with insurance companies, with getting all the sectors together. How do you get the education sector, the social service sector, the health sector, the prison sector, the business sector, to come together to understand that we need to fund this? So our ask for Congress, which is when I'm going to stop, is we request congressional and agency support. So agencies are important too, for funding for parenting skills interventions that can be conducted in a pediatric medical home. As I said, support must be beyond pilots and include significant scaling up of programs. And of course, we want congressional funding for federal research so that we can understand the full array of benefits that children can experience when we help their parents become better at parenting. And I would add, we need funding for implementation. If we're going to scale these up, let's study how to implement them in an effective way. Thank you.